Hi, and welcome to Stay Alive and Fit. I am Liz Goodman, and I want to welcome you to my show, Stay Alive and Fit. And I want you to call into the show to ask me questions at 888-545-1470. That's 888-545-1470. Ask me to find the answers to all your fitness and medical questions. I'm not a doctor or a nurse. The sight of blood makes me squeal. I am just an ordinary gal trying to navigate through the maze of all the ways I can stay fit, focused, and feel fabulous at almost 50. That's right, folks. I'm almost 50, which is just unbelievable for me to say. So with me trying to get through this maze of all the things that are changing my body as I'm getting older, and whether you're 20 or 80, male or female, trying to work your way through this maze, mixed messages about what's best for your health can make you feel like you're on a runaway train. So get on board and take a medical ride with me, and we'll stop at every station to find the answers you seek. So, to begin my journey, I want you to join me in my discussion, and we will help solve your medical health, wealth, and fitness issues. Each week, we're going to give you a 60-second sneak peek with PR specialist David DePino from Tenet, Florida Physician Services. He's going to tell you breaking medical news prior to its release. Hear it first on Stay Alive and Fit before it hits the presses. So listen for a minute or miss it in a minute. Welcome, Dave. What you got for us?
Thank you, Liz, for having me. I want everyone to save the date. We have a neuroscience symposium sponsored by the Advanced Neuroscience Network at Tenet, Florida. And it is May 13th and 14th, 2016 at the Boca Resort and Club here in Boca Raton, Florida. It is called Interdisciplinary Care and Neuroscience, Breaking the Silos, and it features our neurologists and cardiologists giving you the latest in what's going on in health. One of the physicians that we have on is Dr. Azrit of Sunrise Medical Group. We have Dr. Borrego as the shark doctor up in Palm Beach County for the Level 1 Trauma Center at St. Mary's Medical Center. Dr. R.F. Dalvey, who is an internationally renowned Parkinson's disease expert and specializes in brain stimulation programming. Dr. Hernandez-Frau, an epileptologist at Palm Beach Neuroscience Institute. Dr. Amy Jarvis, which I'm really looking forward to. She's a former neurological consultant with the NFL and the Jacksonville Jaguars. Dr. Ritesh Kaushal, Level 1 trauma, stroke, brain aneurysm, and works at the trauma center there at Palmetto General Hospital. Dr. Ali Malik, who also goes in the brain intravenously to remove deadly blood clots, stroke, brain aneurysms. And also Dr. Monica Mejia, a stroke neurologist. Dr. Mueller, a stroke neurologist. And finally, last but not least, Dr. David Wiseman, who's an electrician of the heart. He's a cardiac electrophysiologist. So join us May 13th and May 14th at the Boca Resort and Club.
So is this like breaking news, Dave? Has this been released to the public yet?
This has been released to doctors, and I just want to add, it's not open to all the public. It's open to all doctors and nurses across the nation.
Okay. So I heard you say something about a shark doctor. What's that?
So Dr. Robert Borrego is a surgeon at St. Mary's Medical Center, and as you know, on the east coast of Florida, we have a lot of shark attacks during the year. He has carved out a niche as the go-to guy at the Level 1 Trauma Center for treating shark bites in Palm Beach County.
That's really interesting and fascinating because as we're coming into the summer season with a lot of shark fishing and other kind of fishing, I think it'd be interesting to maybe bring him on the show and find out what you do if you ever got caught in the water and you got bitten by any kind of a fish, really. I mean, I'm sure there's eel bites. There's other things besides shark bites that people probably aren't even aware of.
And all kinds of stings. I mean, we just had a issue with man-o'-wars on the beaches here. So, he'd be great to have on. And like I said, he's the Level 1 trauma surgeon for shark bites in Palm Beach County and also treats from the Treasure Coast.
Okay, well, so you've given us some exciting news for doctors. Any exciting news that you can tell us about, like sneak peek news, if not this week, then next week, that the public might need to hear about?
Definitely. We're going to be talking about the Convergent procedure next week for heart arrhythmias and atrial fibrillation. As I mentioned, Dr. Wiseman, who's an electrician of the heart, he partners with a cardiothoracic surgeon to treat heart arrhythmias from the inside of the heart, and the cardiothoracic surgeon goes to the outside of the heart, minimally invasive. I've talked to a few patients who've done testimonials with us about it. They said the hardest thing was just being in the hospital for 12 hours. It's amazing what they're doing nowadays. The procedure does not take 12 hours. It's mostly observation. Procedure is over in a few hours.
So, David, why don't you tell me a little bit about who you are, what do you do at Tenants, and sort of your thinking about where we're going to go with the show as the upcoming weeks, happen.
Sure. Obviously, I'm a PR specialist. I'm a former reporter for the Sun Sentinel here in Palm Beach County. Was brought over by Tenet 3 years ago. And moving forward, I have never seen medicine move as fast as it has today. Every day it seems like I'm getting a new tip from one of our physicians, clinical research that we're doing. We have 3 groundbreaking clinical research trials going on right now in Palm Beach County that I'll be able to talk to.
What kind of groundbreaking?
So there's they're doing cartilage harvesting for knee surgeries is one of them.
Interesting.
The other 2 deal with the heart, and they're dealing with 2 of our regional medical directors for cardiology. And I can bring a little bit more on that one next week. It has to be approved. So.
Okay.
But
I think that's what I'm hoping we're going to be here. A little bit of that up-to-the-date minute information that isn't quite released, so that if people tune into us, they're going to learn something that they really haven't heard anywhere else. That's going to be the cool thing. That's one of the reasons I've got David here with us, folks, because he's going to be able to answer some questions and get you in touch with doctors. And if you want to call him when David's on the show also, our number is 888-545-1470. He's very knowledgeable in everything to do with Tenet Hospital Group. And, specializes in Florida, but you're connected with your fingers on the pulse all across the country with all the Tenet facilities, right?
We have physician groups, Tenet Physician Resources, TPR, in Arizona, California, the Chicago area, Detroit area, so Michigan and Illinois, Philadelphia region, and then a whole southern state region, which is North Carolina, Tennessee, and of course Tenet, Florida.
So you mentioned something about, I'm looking at our screen and there's something really funky going on. Freddie, our producer. There we go. So we're going to learn and grow together on this show. And, right now we are, we're going to fill out the kinks or free up the kinks or fix the problems. I don't know. We're going to figure it all out as we grow. But what we want you to do is we want you to tap into our Facebook page, which is Stay Alive and Fit with Liz Goodman. And you can find us on Twitter under the same handle and also on Instagram. Please like our page, help us grow, share it with your friends. It's really important because what we're going to bring to you is never before heard information from a really unbelievably forward medical group. You'll be able to call in, especially with Obamacare and all the things that are going on that make it very difficult for some of us to get the very best care. I mean, I know in my situation, I lost my very good medical coverage, and now I have to go on a different kind of medical coverage, and I can't see the doctors I used to see, want to see, and I can't always get to doctors without approvals. So if you come and call and join our show and join our program, you might get a chance to speak to doctors that you otherwise couldn't speak to if you were in a medical group that just doesn't allow you to speak to those physicians. So that's one of the wonderful things that I think that we're going to offer here in the program. So it's not just groundbreaking technological information, but we're also going to journey, hopefully, if I remember last week's program, to the hospital itself. And we're going to get to be part of seeing some video procedures as we grow. And we're going to have really exciting, innovative doctors talking about health and fitness. You mentioned a knee surgeon with cartilage replacement before, and I know I'm hoping to get some football coaches and some bodybuilders and fitness gurus and health gurus on this show. We can talk about things that aren't just medically based, but actually will coincide with everything medical, because you have to have the physical, the metaphysical, the psychological, all those things go together with staying alive and staying fit. It's not just medicine, right, David? So that's our goal, is to work with Tenet together with fitness experts and Eastern medicine, Western medicine, a little bit of everything here, right?
Definitely, from groundbreaking clinical medicine that's going on, and also even holistic well-being that we talked about.
Absolutely.
We're going to bring you both sides of it and, be your source locally for the, up-to-the-minute medical news in the area, and nationally and internationally, because we have internationally renowned physicians.
So for us to grow and for us to give you the information you seek, we need you to email us at liz@stayaliveandfit.com. Text me at 516-395-6363. Call in Monday nights from 7 to 8 p.m. at 888-545-1470 and must like and share our Facebook page, because if we grow, you will become more knowledgeable and we'll all grow together. So I'm going to now kick it, unless you have last thing to say, David?
No, great. Thanks for the opportunity. And, tune in here again next week for up-to-the-date medical news.
Okay, so we're going to stay tuned to WNN 1470 WNN. You're listening to Stay Alive and Fit with Liz Goodman, and we'll be back in a minute.
Elite Home Health is a CHAP-accredited and Medicare-certified home health care agency that is owned and operated by registered nurses, all with advanced skills and extensive experience in home health care. Our team of caring professionals includes registered nurses, licensed professional nurses, registered physical, speech, and occupational therapists, medical social workers, and certified nursing assistants. Call today, 561-271-9020 for more information. Elite Home Health delivers care to you or your loved one in the familiar comfort of your own home. Medicare pays 100% of the cost with no copayment and no deductible for qualified homebound patients. Elite Home Health Services will develop an individual plan of care to meet your specific needs. Skilled registered nurses and physical therapists will plan and implement your care along with your participation and your doctor's guidance, assuring a plan specific to your needs. We will make multiple visits to your home over weeks or months to make sure that you are recovering according to plan. Visit our website, www.elitehomehealth.com, or call 561-271-9020 and let us treat your loved ones with elite services. Times are tough, and right now those in the commercial world know that being heard via advertisements is the name of the game. AmpSquare.tv understands how important advertisement is and is proud to express that it's truly the only plugged-in internet television production company on the market. Amp2.tv live streams all their shows across all the major selling markets in the U.S. and abroad. Call them at 866-224-5422. The AmpSquare.tv library allows productions to be seen over and over again, making commercial platforms more usable. Call 866-224-5422. Toll free 866-224-5422. Amp2.tv, the first and only internet television network that's truly plugged in. 866-224-5422. That's AMP2.TV.
Welcome back. So here we go with my immediate flub. I don't know. And there's another flub because it's saying hosted by Daniel Hamill on my screen. So we're trying to fix the kinks. As you know, when any show gets started, it's kind of, mayhem a little bit. So the first mayhem mistake that I made, so we can all laugh about it, is I gave the wrong call-in number. So let me correct that right away. Thanks to Freddie, my producer, who corrected me so politely during the break. The telephone number is 888-565-1470. That's 888-565-1470. So again, as I'm getting closer to 50, my mind is going a little loopy. So maybe next week we'll have a doctor on the show who'll tell me what I can do about my memory. But in the meantime, let's talk about the doctor that's here with us today. And I'm going to begin by giving you this really great catchphrase: slip, slop, slap, and wrap. This is a catchphrase that I found on the American Cancer Society: slip, slop, slap, and wrap. It's a great catchphrase if you're going to be in the sun. It can help you remember some of the key steps you can take to protect yourself from UV rays. Slip on a shirt, slop on sunscreen, slap on a hat, and wrap yourself so that you're covered. So today's guest is Dr. Kimberly Casey Cohen. That's Casey Cohen, Dr. Kimberly Casey Cohen. She's a former cheerleader and melanoma cancer survivor. Her firsthand experience beating cancer makes her a relatable, knowledgeable oncologist that you can trust to give you the very best advice and information on how to protect your skin from the harsh UV rays so that you can stay safe and melanoma-free. Dr. Cohen is an oncologist and another type of surgeon. I'm not even going to bother trying to say what it is. You'll understand why in a minute, folks. But her phone number, if you want to reach her directly, is 305-820-6657. She's been practicing since 2005. She works at Coral Gables Hospital and Palmetto General Hospital. And she's really fabulous. She's really sassy because I've had a few minutes to speak to her over the last couple of days, and she's beautiful. So I'm going to have you guys take a look at Dr. Casey Cohen now, and I'm going to try to pronounce what your other area of specialty before we get into our topic of the day, which obviously is all about skin cancer because we're coming into the summer months. But all right, here we go. Hepatopancreatic surgery. What? I don't know what that is.
Don't worry.
What is that word?
So, Liz, thanks so much for having me on. And you can call me Casey. It's so much easier.
Thank you.
My special is hepatopancreaticobiliary. I mess it up sometimes too, or it's short for HPB surgery, which is a big fancy word for liver, pancreas, and bile duct.
Wait, can you say that to me again now?
Sure. Hepatopancreaticobiliary.
Hepatopancreatic biliary.
Yeah.
Okay.
Super close.
So I know we were going to talk about this at the end of the show, but since we're already sort of on the topic, and we were going to talk a little bit about this very interesting thing that you told me, which is about the liver, I guess.
Yeah.
It's a microwavable liver thing.
Yeah.
Can you tell me about that? I mean, I know I saw something on the internet about you can actually photocopy livers, and you can see those livers in 3D or 4D images. Is that a little bit along the lines of what this is about?
Yes, it's a really new emerging technology that's great. It's almost like a navigational system for the liver, and it helps us delineate exactly where in the liver the tumor is and gives us a better idea of where we're going. The microwave technology that you're speaking about is actually something that's been around for quite some time, but is now kind of fallen back into favor. And what microwave ablation allows us to do is basically go in with a small probe in a minimally invasive technique and basically destroy tumors in patients that wouldn't have otherwise been able to have surgery. Because when you think about it, patients that are having liver tumors are usually patients that have cirrhosis, which makes them more prone to bleeding. So it's very difficult to operate on those patients. So this new technology not only allows those patients to have surgery for liver tumors, but actually does it in a minimally invasive technique, and they can be in and out of the hospital within 1 or 2 days.
But what does that have to do with these sort of 3D scans that I saw? Like that these 3D scans can actually replace... I'm a little confused by it. Like, dumb me down to like layman's terms to somebody who really doesn't understand anything about medical knowledge.
So basically you have to think about it as an apple.
Okay.
And let's say your apple is perfectly good except for there's a worm in some portion of it.
Okay.
And what this navigational system allows you to do is find the worm. And it's just like when you're on your phone and you're trying to find where you're going in a city. Basically, it takes a 3D-dimensional like surface image, and we do it once preoperatively to kind of give us an idea of where the tumor is. And then once we're intraoperatively, the technology, actually you run sort of like water and an ultrasound over the top, and it sort of gives you this 3-dimensional model, and then it gives you sort of the coordinates and allows you to direct your therapy exactly where it is, almost like a GPS tracking device.
Wow, that's really, really cool.
It's very cool. It's super exciting.
See, what's really exciting about Tenet that I'm beginning to learn is that you're so forward and in terms of technology and in terms of like giving people the opportunity to try or be involved in innovative procedures that can really change their life or save their life, where maybe they may not find those procedures in other hospitals or other hospital groups.
It's true. And one of the things I really love about Tenet is many of their hospitals are just right in your community. Mm-hmm. You used to have to go to a big university center to have these types of technology offered to you. And I think it's great that Tenet has offered these more technological advances in community hospitals.
Very interesting. So, Casey, I want to get in, and thank you for letting me call you Casey.
Oh, sure.
I want to get into a little bit, before I get into your specialty of melanoma, mm-hmm. I want to get into a little about you, because you're very approachable, you're very likable, you don't even look old enough to be like, you look younger than my 10-year-old daughter, I have to be honest.
Oh, God bless you for saying that.
I'm looking at you and I'm like, oh my God. She's like, I don't even want to be on camera with her. You're so beautiful. You're so sweet. You've really been very approachable with me, and I appreciate that, because when I go to a doctor, I want to feel comfortable. And sometimes I don't. I'm a little nervous to discuss everything openly with my doctor, but I definitely get this feeling when I'm sitting in a room with you that I could pretty much tell you anything and show you anything, and you wouldn't make me feel embarrassed by that.
Oh, that's so kind.
I understand that you were a cheerleader.
Yes, I have since retired my pom-poms, but I did, and I'm still a huge University of Georgia Bulldog fan. It's hard down here in like University of Miami, University of Florida land to sport the red and black, but I still find some places where I can watch the games.
So, but when you're a cheerleader, you really have to apply a lot of hard work. I mean, people think it's all fun and pom-poms, but it's actually a lot of hard work, because I have a cousin who was a cheerleader, and she was constantly having to go to practices and constantly having to, not only do her studies, but keep up with her studies to stay on the cheerleading team. So did that sort of drive you? Was that the beginning of you realizing what a driven, passionate person you are and how you could really focus in on things?
I think so. I mean, my whole life, I actually grew up thinking, I don't know about cheerleading. I was actually a competitive gymnast. And my goal was either, as a little girl, I always wanted to be an Olympic gymnast. In my day, it was Kim Zmeskal and Brandy Johnson. Like, those were my heroes.
Now we know how young you are.
Exactly. And then I think my gymnastics sort of made me driven and disciplined, because at some point I almost left my family and moved to Texas to do it competitively. And the goal was to do scholarship, go to University of Georgia and gymnastics. But unfortunately, I had an injury that didn't allow me to do that and have that part of my dream fulfilled. And the next best thing was cheerleading, which I grew to learn was much more athletic than I had ever imagined. And so that was the first time, gymnastics is sort of an individual sport. And cheerleading was great because it was more of a team effort. And now in a career, certainly in medicine, it's more like I learned a lot more about teamwork.
Well, I actually brought up your cheerleading for a point.
Okay.
So, you'll catch this with me. I always have a way to circle back. So here's my full circle. Being a blonde-haired, blue-eyed, fair-skinned girl like you are and I am, we were both born, we were actually born blonde, folks, and you can tell by how fair we are, though I'm kind of tan now living in Florida.
Right.
Being a cheerleader and being outdoors at games, cheerleading, even in Georgia, part of what I put on Facebook was a tip that you and I had talked about over the last week, which is it doesn't matter what time of year it is. It could be dead winter in New York. You're going to get harmful UV rays, and they're going to be cancer-causing rays. And somebody who's fair-skinned and blonde and blue-eyed and fair-skinned, but even somebody who's got dark hair and dark skin, it doesn't really matter. The rays are harmful. But you, unfortunately, when you were cheerleading, I'm sure were exposed to a lot of bad rays, didn't know everything at that age as to how to protect yourself. And you went to medical school, and then you want to tell our listeners a little bit what happened to you and how it kind of changed the course of the direction of what you were going to practice in medicine.
Sure. I loved the sun.
See the full circle there?
Yes, I do. It was perfect full circle. So as a kid, I was actually, I always wanted to be tan. I was teased a lot. People called me Casper the Ghost,
I understand,
Whitey.
me too.
And I just thought tan people were healthy people. People thought I was sickly or just getting over the flu. And so I had wanted to be...
And sorry to interrupt,
No.
but now it's so funny because when I was a kid, I was like tan, golden tan was beautiful.
Yeah.
But now when I look at somebody who's really tan and leathery, all I think to myself is, ew, they're so, like, they're poisoning their skin. And it's so funny that your mind changes now. I literally see these tan people and I think to myself, oh my God, those poor people, they don't realize what they're doing to their skin. Not that they don't look beautiful, they look beautiful, but they're really hurting themselves. They're harming themselves. I mean, maybe not everybody, because if you're a dark-skinned person, maybe it's not the same as if you and I were really tan. But yeah, it's amazing the way it has changed.
I'm so happy the perception is sort of changing. And I think that there's been a lot of education and with, the evolution of sunscreen, and now we know more. I just read a statistic the other day that melanoma goes up by 3% every year.
Scary.
And so now we're trying to educate, and more research is going towards melanoma. So maybe, I always say I have to embrace the pale, because I just have to love the skin that I'm in. But
I like that, embrace the pale.
Yeah.
But embrace the pale and protect the pale.
It's
That's
true.
the point. So you went to college, or you went to you were doing cheerleading, and then you went off to medical school. And at what point did you discover that you yourself had melanoma?
So I was actually, I think, a first-year resident, and I looked down at my arm. It was a mole that I had my whole life, and it just looked funny. It started to have like a red ring around it, and it was bleeding, and it was itchy, it was painful. And so it just didn't look normal. I thought, well, maybe it's infected. Did I bump it? And I was very blessed in that my program director at the time was actually into melanoma. That was one of his specialties. And I went immediately to his office and I said, look, this just doesn't seem right to me. And immediately he took me downstairs to the procedure room, was like, that needs to come off. So I think intuitively I knew that there was something bad wrong. And I sort of knew in the back of my mind, like, this is probably melanoma. And of course the pathology came back and it was melanoma. And at that point I got really scared. That was not actually my first skin cancer. My first skin cancer was actually a squamous cell.
What does that mean?
Squamous cell is a different type of cancer. It's not as deadly, but it's definitely more common. And it's something, as we get older, they usually show up as those pink kind of flaky areas. And you think maybe at first they're a bug bite or they're just sort of somewhere where you hit your arm. And then 2 or 3 months later, they're only getting bigger and pinker. And it's just not a good situation. So that was my first melanoma. And then I had melanoma again 3 years later that my mom actually discovered when she was putting sunscreen on my back. And she said, you know what? I've seen you your whole life. This is completely different. And that one was actually a little bit more invasive than the first one I had.
So speaking about melanomas and different kind of spots and dark spots that you detect, when you have that experience, and you have a melanoma, first of all, what is the first course of treatment that happens? Do you have to have it frozen off? Do you have it biopsied? Like, what were the steps? And then what? Then you became a doctor. And so sort of tell me the way that you went from having cancer and being treated for it to treating others for cancer, and how having had your own experience with it helps you treating patients.
Right. I think sometimes it takes getting our first little age spot or skin cancer to make us realize we need to start doing skin surveillance. And the best way, I think, to start down that path is just to have a loved one or somebody that may see you every day kind of check those areas that we don't normally see. And if there's something that you do find, then it would be going to see a dermatologist. When you go to a dermatologist and they think that they see something suspicious, they have a bunch of fun tools and little reflectors that they put on your skin. Usually the first step is a biopsy. Definitely, now melanoma is very different than the other two types, which are squamous and basal. Squamous and basal are usually pink or red and they flake.
See, I've had basal cells on my face. They called them precancerous. So they were frozen. When I was in my 20s, they discovered it, and I had this ring here, and they froze it off. And 3-4 years later, it came back. Then first they biopsied it. When they biopsied it, unfortunately, I wasn't smart enough to know to go to a plastic surgeon. So I ended up having this little scoop there, which I was very upset about, which nobody can see but me, I understand. But I know it's there, and I see it because it remains like a little white spot on my face. So even when I put face makeup on, I always see this little white spot.
Right.
But every 3 to 5 years, it would come back, and it would come back. Finally, ironically, I went to a doctor here in Florida after years and years in New York, it getting, frozen off. And she didn't do it with that freezing, that powerful thing they just...
Yeah, the liquid nitrogen.
Right? She actually took a Q-tip, which hurt a lot more, but she put the Q-tip on it and froze it, and thus far it has not come back. And I don't know whether that method was more effective or if it was just the umpteenth time was the charm, but it seems to be 3 years later and I don't have any signs of it. So is it because it's a better method, or is it because finally after that many times it eventually does...
Sometimes freezing it only gets that top layer. Sometimes you need to go a little bit deeper and maybe a deeper application, or maybe that first layer had come off and you just needed to get to the deeper surface there.
So that Q-tip on it was sort of getting in deeper.
Exactly.
It hurt, I'll tell you.
Yeah, it does. It's like a burn. It basically is a burn. And that's the thing about basal and squamous cell carcinomas, is they may not be lethal, but they're certainly disfiguring, especially if they're on the face, which, especially on the bridge of the nose, around the eyes. That's why, when you go outside, not only sunscreen, but a hat is more effective, because the dermatologist, if they see something suspicious, they're most likely going to do what we call a shave biopsy, which is basically taking the top layer of your skin off.
So I'm going to have to stop you there because it's 7:30 and it's our half an hour. We got to go for a break. But we will be back right after these messages. And please feel free to call into Dr. KC at 888-565-1470. And thank you for listening.
Statistics state 1 in 4 people are bullied. I believe that everyone at some time in their life is bullied or intimidated by another. Why are some devastated by it and others just shrug it off? It all lies in their personal value. Bullyproofing You is all about building your personal value. It is about a decision you make and action you take. You must decide you are valuable. Stop letting others define you. Between stimulus and response, there is a space. In that space is our power to choose our response. In our response lies our growth and our freedom. Victor E. Frank. Start choosing to believe in yourself and your value. Jeannie Cisco Meth can give you the tools needed to change your life, to bully-proofing yourself and your family. Her live one-day training will transform your future into the life you have always wanted. To purchase your tickets, go to www.bullyproofingyou.com/products and start creating your phenomenal future. For several years, Quality Tax Plus Services, Inc. has developed tax strategies for Coral Springs business owners as well as individuals and families. From bookkeeping to payroll, straightforward tax preparation, or complex audit representation, Quality Tax Services, Inc. is recognized for customer-oriented service and financial acumen that results in smart tax solutions. Call Quality Tax Plus Services at 954-969-0012 and ask for Harry. Part of the services Quality Tax Plus offers is life insurance, the most important insurance to have. But there are many people in Florida who do not have it. It is true thinking about the end of one's life can be uncomfortable, but when it comes down to it, life insurance is not about you, but those you leave behind. Make the right choice and find a life insurance plan that is right for you. Cover your tax and insurance needs at Quality Tax Plus Services. Call 954-969-0012 and ask for Harry. Visit their website, qualitytaxplusservices.com, or call 954-969-0012 and let their services help make your life worry-free. 954-969-0012 and ask for Harry.
In today's world, only the elite receive the very best, most comprehensive care or advice. Call in and speak to expert doctors from Tenet Health and be an active participant in your health, or text your questions to 516-395-6363. Ask Liz, your source for the latest medical technology and long life advice.
Hey, and my computer just, there it is. Hi, and welcome back to Stay Alive and Fit with Liz Goodman and Dr. Casey Cohen. So apparently we've got a caller. I think Lauren's on the line. Is she there?
I'll show you her picture.
Oh, it's a little bit noisy. Lauren, are you on the line?
Yes. I'm with a bunch of girls. I want to just put you on speaker. Hold on.
Oh, no, you can't put us on speaker. We're on the radio. It's too noisy. Please don't do that.
Okay, can you hear me? Oh, okay, then I'm going to take you off speaker.
Yes. Can you you have a question for Dr. Cohen?
Actually, I have two questions for her.
Okay.
One, I heard about a product called Bella, and it's supposed to be lasting 5 years.
Bella,
Is
now
that
that's one I'm not
true?
familiar with. Is that the brand name?
Bella, I was told.
I don't know what that is. We don't know what that is.
Okay. All right, then another thing is, what do you think about the fat injections from your own body?
Mainly that should be done by a plastic surgeon.
By a plastic surgeon. Do you think it's a good thing?
You know, the evidence with fat injection is kind of hit or miss. I don't think that they're doing many fat injections for the face. But usually the plastic surgeons are sort of the best person to go to, and you actually need one that's very specialized in fat injections. Now, if you're talking about the dermal fillers like Juvederm or Restylane, one of those injectables, those are actually, there's a lot more evidence for that, and those go for more for the facial injections.
So Dr. Cohen's specialty is actual melanoma and cancer spots. So do you have any questions regarding any kind of skin cancers?
His specialty is melanoma. My husband and my very, very close friend's husband had melanoma. So my question with melanoma would be, when my husband had it across his neck, they removed it, and he is careful, but sometimes he walks in the sun still. They removed it twice with Mohs surgery. Mm-hmm. And I'm nervous. How will I know myself? I mean, he goes to the dermatologist every 6 months, and they check everything, but I'm just very nervous that it would come back and we wouldn't know about it.
Sure, and I think that, 75% of melanoma actually arises in a mole that you already have. And when you look at those moles, you're thinking of the mnemonic A, B, C, D. So you're looking for asymmetry, sort of like if you're making a sandwich and you cut a sandwich in half, it should fit exactly on each side. So if you could fold the mole in half, it would look identical.
So if it doesn't look identical, that's
On
when
either
there's something
side.
wring?
Right.
So if her husband, thank you so much for calling, Lauren.
Thank you, Lauren.
We're gonna talk about it now. Thank you.
Okay.
Bye,
So
Lauren.
I know we have another call on the line, but let me just ask you that question. So if her husband had some moles removed and then they're growing back, or is there a certain way that he needs to protect those areas differently than other parts of his body?
Sure, not only for, keeping the mole from, or checking it to make sure nothing's coming back. Usually as a surgeon, we take a pretty wide margin. So you would notice some redness. Mainly the biggest thing is what we call ulceration. And that's basically almost like a blister that breaks open and bleeds without you doing anything to it. And that would be ulceration. That would be one concern, that the melanoma is coming back. But you also want to protect it from the sun, just because, in the sun, scars are so much worse than if you protect them from the sun.
Is there a certain kind of sunblock, or does it really matter whether it's a 50 or 70 or 20 or 100? I mean, is there a difference really?
There is. It's very scientific about sunscreen. Now I have to be super religious about it. But
Okay.
you really need to get something greater than an SPF 30. So you have to think about it. So it's interesting. For me, I'm very pale. So the natural SPF in my skin is 3. So I can be out in the sun for basically 3 minutes and I'm going to burn and I'm going to get sun damage. So if I use an SPF of 30, you basically multiply your natural SPF by 30. And that's how many minutes you can stay in the sun protected. So I can stay in the sun 90 minutes kind of carefree with an SPF of 30. So if I do 50, then I can stay in the sun almost 150 minutes.
You know what? I never understood that the SPF actually relates to how long you can stay in the sun. I always thought it had to do with how much extra protection you had.
You think 100, man, that's going to
so,
be
yeah. I mean,
force
listen,
field.
I'm probably not a 3. Maybe I'm a 5 or a 7 because I'm slightly darker than you. But I
Right.
have a son whose father's from the northeast of England, and he's very pale.
Right.
And he didn't have a freckle on his face, and we're living here 3 years, and now he's got freckles everywhere. And I put SPF 70 or 100 on him, and he's still, getting these little freckles coming out. So I get upset by
Right.
it, and there's nothing you can do to protect kids out here.
And the other thing you have to make sure is that it has broad spectrum, because UVA rays we've known about for years, and those are the ones that kind of give you the suntan. The ones that, and now it's proven through tanning beds, which you used to proclaim they were safe because it eliminated the UVB rays, which I'll talk about in a second. But tanning beds have UVA rays, and we notice now that the increase in skin cancer is almost 100 times if you laid in a sunbed before the age of 30. So,
Which
is
I definitely
terrible.
did back then.
Yeah.
So that makes me very nervous and anxious.
So
We all did. I used to use reflectors. But it was also true that I think we have a caller on the line. So we'll get back
Okay,
to this in
all
a
right.
second. Is Max still on the line?
Yes.
Oh, hi, Max. I'm sorry. We're gabbing around here. We've girls gift of gab. So I'm sorry we kept you waiting, Max. You have a question for Dr. Cohen?
Yes, I do. I'm of Mediterranean descent, olive complexion, and my mom had a mole on her neck that she had removed. Since then, it never came back, and the mole was never diagnosed with. It was diagnosed as a benign mole or not malignant. The question I have is, since obviously it's my mom and we carry similar or same genes. And I'm starting to see spots on my skin, more like reddish spots, nothing flaky, or that would cause me concerns. But the more I get exposed to the sun, the more I see these red spots. And I'm not sure if it's time to go see a doctor or.
So you mean like little tiny red dots that are coming out on your skin?
That is correct.
I've actually seen a couple of those on my
Yeah.
skin too.
Those are actually in Mediterranean descent. By the way, hi, Max. Thanks for calling in. Those red spots of Mediterranean descent, those are usually hemangiomas, and those can be benign. What you need to worry about is that they're more flush or flat with the skin, and they peel a lot. So any kind of a peeling mole is definitely something to be concerned about.
I mean, like a little red dot on the skin?
Now, little red dots are usually hemangiomas, but in dark-complected people, it's very difficult to tell the difference. So
I see.
I actually recommend that any person that's very dark-complected that sees a change in a mole at all should see a dermatologist, because it's a little bit more difficult to diagnose skin cancer in a dark-complected person, because you're not going to see their changes are going to be a little bit more subtle.
Do you have any follow-up question, Max?
So, in regards to, I know you guys were just talking about the SPF.
Yes.
What would you recommend for somebody from Mediterranean descent? Because most of the time I don't have any problem going out on the boat and not having to apply anything. Now, yes, I do burn a little bit, but it's not bothering me. Could that, if I do have some type of genes that may be a precursor to melanoma, would that speed it up in any way?
You know, that's actually a really good question and a good point, Max, because we're sitting here talking about the blonde hair, fair skin, and how everybody thinks, I think a couple of misnomers are everybody thinks you only need sunblock in the summer, and everybody thinks you only really need sunblock if you're pale. But the reality is it doesn't matter if you're African American or Asian. Everybody can get melanoma, correct?
It's true. And anybody can get any kind of skin cancer. So if you're dark complected, especially Mediterranean descent.
And dark people seem to think they can still slap on the oil. And I go out with my friends and they're putting on oil or 8 and I'm putting on 100.
Right.
And I'm looking at them like, are you nuts?
And what's the difference is the dark complected people have a built-in SPF of 13. So
it's still not 30,
right.
And we need to be 30 or more.
So basically, Max, you could burn in 13 minutes. So by using, and I'm not going to do math, I'm not going to even try. But
Don't ask me to try to do math.
30 times 13 there, you can do the math. So basically, everybody needs sunscreen. And
we've got a math whiz on the phone. He's giving you the answer.
Yeah, exactly.
Thanks, Max, for showing us up.
And you have to bear in mind, think about Bob Marley. Most people don't know this fact, is that Bob Marley actually passed away from metastatic melanoma.
Oh, that's correct. That's right.
And
You're right.
Very, very dark complected. He actually had it on his toe. So there are some components of melanoma that are more prone in dark-skinned people, and you really need to check the non-sun exposed areas,
on
palms
his toes
and soles of the feet, back of the head. Men, of course, in general, men get more melanomas on the trunk, meaning the back and the chest. Women, it's our arms and our legs. So for you, Max, especially make sure that, somebody checks your back and stomach for any kind of moles that have changes.
Mm-hmm.
Max, does that answer your question?
Yes, thank you very much.
Okay, welcome. Max, thank you so much for calling. And please listen to our show every Monday night from 7 to 8 p.m. and tell your friends about us and like us on Facebook and share it. So anyway, Dr. Casey, that's really great information you're giving, because honestly, most of my friends who are, I come from Russian Jewish descent, but I have a lot of family members that are darker, Syrian or Middle Eastern, and they, they walk around and they think that they can just slap on the oil and still go out to the beach every day and get sun. And I don't even like the beach anymore because I'm so afraid of it. Honestly, I don't know. I don't feel like I can protect myself enough.
It's true.
Especially when I think about back in my younger days when I was growing up, we would sit out with sun reflectors.
Oh, yeah.
Tanning beds just came out when I was in my 20s, and I was at them all the time. And now, since I'm in my whatever age, as I've told my listeners, I'm close to 50. But since I've been in my 40s, I've really made a point of staying out of the sun as much as I can. And I know the damage isn't about what I've been doing the last few years. It has to do with what I did when I was a kid, right?
Exactly. Before the age of 30 is really kind of the critical period. Blistering sunburns, the sunburns where you peel.
And I got a lot of those
bubbles.
as a kid. Yeah.
Yeah. So you just have to start surveillance now. I mean, we don't have a time machine, and boy, I wish I did, because laying in the sunbed would have never been
I know.
a part of my life. But now you just have to start skin surveillance. And the most important thing now, let's say you haven't developed a skin cancer, you've come unscathed from that, you have to worry about aging. 90% of aging is from photo damage. So the main thing about
You're really making me want to curl up under a blanket and like turn the clock back 30 years.
It's true.
I'm like, you're freaking me out.
I know. I'm very good at that. Sorry.
I'm sure you are. I mean, especially what you said about Bob Marley. You said it was.
Yeah.
Like, so he found it on his toe.
It
Well,
is.
I mean, why was that not detected before? Is it because we're not going enough to doctors' offices to get our full body exams? I mean, should we be doing it twice a year, once a year, every 3 months? How often? And does it change as you get older?
Right. I think basically having doing a self-check on the parts that you can see is really important, especially if you're fair complected. It's almost like women that do self-breast exams. I think part of that needs to be a skin check, and a skin check is actually a good skin check is 10 minutes long. It should take you about 10 minutes to check your skin. And for the parts that you may not be able to see, your back, having a loved one do that.
What if you don't have a loved one who you can ask to do that? You're a single
Exactly.
mom. You're not going to have your 8-year-old to check your back.
Then I think it's time to go to a dermatologist. I think there's never a bad age. Most of us have gone to dermatologists anyway, either for one reason or another, acne or, aging, or we're about aging. You might as well get a full body check when you're there, which should be part of any dermatological exam.
So, I mean, not to plug, a brand of sunscreen, but I'm
Right.
sure all mothers want to know, and all grandmothers want to know, and grandfathers, and just people in general want to get an idea if there's certain brands that you think are better than others. I mean, we hear that titanium is bad for you, or oxy whatever is bad for you. I mean, are there certain ingredients that we should really be looking out for when we're buying sunscreen? Forget the brand, but like specifically look for that ingredient, make sure it has that ingredient, and stay away from this other ingredient.
Sure, absolutely. I think like I said before, looking for the SPF greater than 30.
Okay.
Anything that says broad spectrum, and the FDA is going to check those to make sure, because what broad spectrum means is not only UVA, but UVB, because the UVB rays are the ones that are actually the ones that are on the reflectors. So even if you're snow skiing, those are the ones off of the water, and those cause the most sun damage, and those cause aging, those cause cancer.
Okay.
So we're looking for broad spectrum. That's the key word. And when you see that in one of the ingredients, you should see one of the dioxides, like a titanium dioxide. Or silicone dioxide, and that's going to give you the added protection. So those are the two words. One thing.
So titanium dioxide.
And silicone dioxide.
Okay.
The SPF greater than 30. The
Are
other
children different than adults, though?
children are different after the age of 6 months. Keeping a child out of the sun before the age of 6 months is critical, because there is some literature to suggest that using a sunscreen in a child less than 6 months old can be harmful just because of the chemicals. But
I wish I could remember whether I did or not. We lived on the beach, so I don't even know.
So
I probably
under
did.
6
If
months,
he's 6, my baby was a May 9th baby.
Right.
So there's no way I didn't put sunblock on him when
Right.
he was,
and that's
in the
minimal.
summer.
Those are usually allergic reactions. Usually has nothing to do with development.
Okay, because you're making my heart palpitate a little bit there.
I'm very good at freaking people out. So, but like I said, the UVA, UVB, broad spectrum, SPF greater than 30. And then one thing to remember is that PABA free. My skin is very, very sensitive. And I used to get that red rash, which has turned a lot of people off to sunscreen. But those sunscreens were mainly the PABA ingredients. So I don't really recommend using any kind of a sunscreen that has PABA in it, which is PABA.
Well, I'm going to have to go back and check. So, like I said, I have a young kid, and he's blonde hair, blue-eyed, fair skin, and he's 8. And I put sunblock on him every morning.
Right.
And it's some organic brand that I bought in the supermarket, in Whole Foods or whatever. And every time I put it on him, he says it burns his face.
Yeah.
But no matter what brand I put on him, he says it burns his face. And then I send him to school with one of those little baby sticks so that I tell him, before you go out during lunch, you need to put that stick back on your face, because he was coming home burnt.
Right.
And you can't count on the teachers to do it. So why is that burning his face? I mean, no matter what brand, is it because he's allergic, or is it because his skin is already sort of burned?
Some of the sunscreens actually have an alcohol component to them, which sort of...
And this is supposed to be an organic brand.
Right. So you really have to look on the back and see if there's some component of alcohol in the brand. Some people are just very sensitive. Sometimes the reaction to some of the other chemicals, even the organic brands, because when you think about it, all medicines are made from plants. But I would suggest that using something that has doesn't have alcohol in it.
So is there a specific brand that you recommend for children? I mean, I know I don't want you to necessarily sponsor a brand, but if there's something you recommend, I think people want to know that you
Sure.
like something better over something else.
Anything they will tolerate to let you put. Children are notorious for they get fussy and whiny. They don't want to have sunscreen. One thing I do like is the spray-ons.
You do like
I
the
do.
spray-ons.
I do like the
actually thought the
spray-ons.
spray-ons were like stay away from them because they're aerosol.
They're quick. The children usually tolerate them a little bit
But on
more.
the face?
But not on the face.
Right.
So if you can give their arms a quick, spray, make sure it's, completely rubbed in. But sometimes, I see a lot of moms and dads on the beach belaboring over the whole, sunscreen situation. And the thing is that once you're putting on at the beach, it's too late. You have to actually put sunscreen on 30 minutes before you go out to let it absorb.
What about the zinc? When people walk around with the white
zinc oxide.
Yeah, I mean, I'm
Those-
always looking for ones that have zinc at least of 6 or 8 or 10 because I was told if it doesn't have zinc, it doesn't really work.
Those are sort of that's the same thing as the dioxides I were talking about. The zinc oxide that used to,
Yeah.
the bright colors
Yeah.
and the football players. And that's
Do they work
actually
better?
the oxide. And now that's in the spray form or the rub-on form. A lot of kids don't like feeling greasy. Not to mention a name brand, but I really do like the Neutrogena. A lot of them
That's
have
the one I like, yeah.
anti-aging. They don't sting. I have really sensitive skin. And actually for the facial lotions, something that, especially for women, using it in our moisturizer every day. There's not a day that I don't go out with at least SPF 30
I
on
do
my
too,
face.
every day. Okay, so we only have a few minutes left, and I want to give out your information again
Sure.
because you're fabulous. And if anybody wants to
thank
meet with
you.
you or make an appointment to see you, they can get in touch with Dr. Kimberly K.C. Cohen at 305-820-6657. That's 305-820-6657. I want to thank you so much for
Oh,
coming
it's my
onto our
pleasure.
show. Is there anything else that you want to give us a quick tip? Because what I'm thinking of doing, if you're okay with that, is next May, as May is coming up, I think it's, UV Protection Month, David? Melanoma Awareness Month is in May. So what I'd like to do is invite Dr. KC to come on the show at the beginning of the month, and you guys can call in and ask her any questions again about what to wear, what kind of clothes to buy, UV protective clothes, any other questions that you might have about staying safe in the sun. And we'll have her on again in May. And I would like to thank Dr. Casey again for
it's my
coming onto the
pleasure.
show and bring David on back here to tell us a little bit about who is going to be coming on our show next week. Right, Dave? Going to give us a little bit of a hint. Thanks, Dr. Cohen.
We have a few options that I'm working on. Dr. Juan Velasquez is our new interventional cardiologist in Broward County. Thinking about having him on, or Dr. Hassan Batanier. That's always got to practice that one. He's our.
How do you say that? Her specialty, Dr. Casey's specialty.
She is a hepatopancreatic biliary surgeon.
Wow. I wish I had a bell. That was
Yeah,
awesome. I still can't say it.
I practiced a lot before she came on board. The other option I'm working on, so Dr. Batanier is a neurologist, specializes in sleep and epilepsy. And the other one I'm working on is actually a nurse practitioner. We have Vivian Carta Sanchez, who specializes in internal medicine, geriatrics, and holistic well-being.
Wonderful. I want to do that. And we want to try to get Coach Partridge on here. We're
I'm
going
working
to
on
do a
Coach
shout out
Partridge.
to him. We want to bring you on here and match you up with some personal trainers or some surgeons that do children's pediatric surgery for cartilage or knee injuries. So if you, our listeners, want to write in or text in or check out our Facebook page and give us an idea of what you would like to learn more about, you can email me at liz@stayaliveandfit.com. Or you can try to find us on Facebook at stayaliveandfit.com. Or, well, Facebook doesn't have a .com, does it? See, I need to get up on my social media. But find me on Facebook, Twitter, or Instagram, stayaliveandfit.com as my web address, and Liz at stayaliveandfit.com is my email address. You can also email David if you want to ask him any questions or try to get more information about Tenet Hospital. I don't really know as much about it as he does, so he can probably give you direct answers at...
Sure. David.dipino, DIPINO, at tenethealth.com. And like Liz said, we have 163 physicians covering about 30 medical specialties. So pretty much everything you could imagine.
And I want to thank my producer, Freddie Santori, for doing a fabuloso job. And I want to thank the guys here at WNN 1470 for allowing this show to air. I'm looking forward to a very exciting year ahead of us with a lot of medical information because, as I told you guys, I'm just a gal who doesn't know anything about the medical industry, and I really want to learn how I can save my life, my children's life, and my friends' lives by getting more informed. And since the medical industry is not as easy to tap into as it used to be when everybody can get medical coverage that was affordable, with Obamacare, not everybody can get good medical coverage. There's a lot of limitations to your plans. I know firsthand that I'm limited with my plan. I can't see any of the doctors I used to see. I've got to get referrals for seeing any kind of specialist. And then, God forbid, I have an emergency today. I have to get a referral. It has to get approved. And it could be 3, 4, 5 weeks before I even see a surgeon. And by then, it could become a major emergency. So if you tune into our show, stayaliveandfit.com on the web, tell us the things you want to learn more about, and we're going to try to put you in touch firsthand with these doctors to give you VIP information that you couldn't get anywhere else. Thank you for listening. Later.
The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.